So for the next bone issue which we'll be looking at, we'll look at what is usually abbreviated as what? DISH. So some people call it DISH. Alright. So this is what is known as a diffuse idiopathic skeletal hyperostosis. Alright. So you can see a lot of things, your normal vertebrae, but here is more of like calcifications, a lot of what? Calcium deposition, so the ligaments are not smooth again, they are rough, chopped off and all of that. So for the diffuse idiopathic skeletal hyperostosis, it's a type of arthritis, right? So it causes abnormal bone growth, especially along the spine. So it's the spine that is what affected. So it's from the bone that is actually, the thing is actually getting to the ligament. Do you understand? So so there's also hardening. There's abnormal bone growth first. There's also hardening of ligaments and tendons. So it's also known as what? Forestier's disease. And why this sounds like something out of medieval medical scroll, it's very common. It's something that you guys just be like, does this actually exist? It's common. Alright, most of them go undiagnosed. Okay, so what does it actually do to the body? There's excess bone formation. So bone grows into soft tissues. So the bone in the spinal cord is growing into the ligaments there, So spinal movements often affect the thoracic spine, can also impact cervical and the lumbar regions. Peripheral effects can cause bone spurs in hips, shoulders, heels, even the hands. Alright, so symptoms is what? Stiffness and pain, especially in the back and neck. Reduced range of movement. Alright, so your back is stiff, so you don't want to move it too much. Alright, so swallowing difficulties. Right, hoarseness if bone growth compresses the throat. Numbness or tingling of the from nerve compression, often asymptomatic. That's why I told the guy that it's common, but most of it go undiagnosed. Okay, so causes and risk factors is most of the times you don't know the cause. Sometimes it's linked to all those metabolic syndrome, like somebody had diabetes, obesity, high insulin levels, right? It's more common in men over 50. Sometimes there's genetic mutations. Alright. Sometimes it's long-term use of what? Retinoid medications. So diagnosis is just X-rays and CT, MRI. Okay. I didn't bring the image in here, but imaging is basically what you can use to settle this, alright? So there's no cure, but just manage the symptoms, like physical therapy just to bring back the flexibility, non-steroidal anti-inflammatory drugs and corticosteroids to manage the pain and the inflammation. Alright, then surgery in severe cases where they have to remove bone spurs because you don't want them to compress nerves. Managing any other underlying condition that is causing it. Okay.